Good morning.
Good morning.
Good morning.
It looks like we have a good number of you already entering the Zoom group chat. The Zoom group. So we'll go ahead and get started so we don't take up a lot of your time this morning. Thank you for being here. My name is Stella Primo, and I am the Executive Director of the Capital Region Family Business Center. And I have been fortunate enough to be able to work with Professor Ryan Fuller in the past. About 4 years ago, we approached our group to do a survey of family business and family businesses' resilience after a crisis. And so it seemed appropriate at this time that we bring Professor Fuller back. And he is graciously doing this webinar for us pro bono, and has also brought on board other of his colleagues and other professors to join the call to talk about different aspects of the COVID-19 virus and our working adjustments we're facing currently. So the way that this is going to work is we'll do a 20-minute presentation, and then we're going to save the remainder of our time for a Q&A afterwards. What you're going to be able to do is at the bottom there's a little box for a chat. You start typing in questions. What we'll do is after the presentation is I'll moderate the Q&A afterwards, and because Professor Rina Hammond is only with us for a short amount of time, she's actually on staff today. Her colleagues have allowed her to step away from her duties to be on the call with us this morning. So we'll start the Q&A with more of the healthcare related questions directed directly to Rina. Everybody good?
Yeah.
All right, awesome. Professor Fuller, would you like to take the next slide?
Well, thank you, Stella, for that introduction. So these are the folks who will be on the call. Myself, Joseph Taylor, who's a professor of information systems in the College of Business. Rina Hammond, who is a nurse practitioner and professor of nursing. And Nitin Roy, who's an assistant professor of public health. Okay, so this is our agenda for today. We're going to focus on. So this would be a good time to remind folks that for the webinar to put your microphones on mute. Very much. So we'll start with the present reality aspect of this. Focus on what's essential and what to do if your organization suffered economic harm. How you can prepare your business for this, considering all of the fast-moving developments that are going on. And then we'll end our presentation with the resilience of family firms. A forward-looking view about what we can do moving forward. So with that, I'd like to go ahead and ask Professor Hammond to present on the present reality from a medical perspective, what she's seeing day to day, as she's working on the front line in the hospital.
Hi, everyone. My name's Rina Hammond. I'm a nurse practitioner. I work for Sutter in the Sacramento region. So I work in an urgent care setting, part of a large outpatient center here. So our current situation, the entire building is currently closed down. Everyone has gone to telemedicine except for my department specifically. So what we've been doing, we're trying to keep patients safe. We're trying to keep staff safe. So anybody with any kind of symptoms, such as like cough, cold, runny nose, any of these COVID type symptoms we've been hearing. Diarrhea has been added to the list now. They're all seen in our parking lot, so none of them enter the building. The only thing that comes in the building are broken bones in otherwise very healthy people. So right now we've got either one of our primaries, so either like myself, a nurse practitioner, or a doctor with a nurse and a medical assistant out in the parking lot. And the parking lot is full. It's packed for various reasons. We've got some very sick people out there. A lot of them are elderly, having real difficulty breathing. And then we've got a lot of people that are just very anxious. This is what we call the worried well, or the walking sick. They're healthy enough to be out and about, but still very likely COVID positive. And mobile, so the risk is, you know, this is the population where you worry about spreading the illness. I think, you know, the biggest issue here is that people are coming in and they want to be tested. And I'm sure you guys have all heard that we are very short on tests. In fact, today we're running on 15 tests total for the day. We'll probably end up with about 150 patients today. But these tests are being rationed out through the various medical facilities that are testing. So that means we've got to choose 15 people that are at the highest risk right now that need to be tested. The reality of the situation is that we've got a lot of people that are going to be just fine, right? Personally, they're going to be fine, but they are a danger in that they're putting others at risk because they're out and about. They're putting the health community at risk because they're out and about. From your standpoint, one of the things that we're seeing and we ask of you is to not require work notes for people to return. I'd say about 30% of the patients that we're getting are saying, I'm going to get fired unless I get a work note from my employer. So there's a lot of panic around, reasonable panic around their jobs. But they're sick and they could be exposing us, they could be exposing others, and it takes away time that we could be spending with people that are truly having a hard time breathing out in our parking lots. So that's, like I said, our request from the community is to have people only come in if they truly are sick and really need medical help. Yeah, there's very specific CDC guidelines on who should stay home and how long they should stay home for. So right now, what they're saying is that if you have symptoms, you should quarantine yourself for a minimum of 7 days from the onset of when symptoms begin. And you should go 3 days without any type of symptoms whatsoever and do whatever comes later in the process. So it could be up to 10 days if that's the case. It could be 14 days, basically just 3 days completely symptom-free and a minimum of 7 days from onset of symptoms. But yeah, that's what we're seeing here at the front line of parking lot, full of people for various reasons, sick people, anxious people, across the board.
Thank you, Professor Hammond.
Of course.
I'm going to have my colleague, Professor Taylor, tell us about some of the resources that are available.
All right, so there's a few things we've put together through, and Brian's, Dr. Fuller's taken the lead on this, of coordinating the resources through the College of Business. So this website link, the csuslibguides.com, this has a combination of all of that content that's been put together. So it's one handy link you can go to. This has been updated on a recurring basis, and we'll continue to update as things evolve. I'm going to take advantage of the group chat right now. So as you can see, if you click on the chat box and likely towards the bottom of your screen, you can type in questions or thoughts. One of the questions that has come up frequently is, all right, well, what's a critical business? What does that mean? Even within a critical industry, there's some jobs that are necessary and some jobs that are not. So the governor put out the order on the 19th, 2 days ago. This document that I just posted the link to everyone It's a 14-page detail that breaks down, all right, these are the critical industries, these are the functions within the industries that are critical, these are the roles that are non-critical. Content like this continues to evolve, both at the state, the local, and national level. So we encourage you to stay up to date with this information. You can use our links, you can use the government links, and they'll give you more details. Also, a common question has come up around, well, what resources are available in terms of loans or other help for businesses? If you go to the website of the Center for Small Business, or not the Center for Small Business, excuse me, the SBA. In fact, I'll go ahead and share another link here. For the SBA, there are many loans that have already been structures approved through the Federal Reserve working with the SBA. As I'm sure most of you are aware, there's a lot of debate going on in Congress right now. And as of 30 minutes ago, they still had not come to a compromise, but it's expected imminently. There'll be some type of federal aid package that will be available, which could involve some stipulations. It could be grants, it could be loans. That is all still yet to be determined, but would strongly encourage you to stay up to date on that information. As I mentioned, we'll also be posting that to the site that the university is providing as well.
Thank you, Professor Taylor. Now I'd like to turn it over to Professor Roy about how you can prepare your workplaces. Professor Roy, are you there? Are you on mute?
Okay. So hi, everyone. I am Nitin Roy. I'm an assistant professor in the public health department in Sac State. So my area of specialization is occupational safety, process safety, and occupational health. So I will discuss some small details about what you can do at the workplace to make your workplace better prepared for this situation. So first of all, make sure that you read the guidelines from all the agencies, the federal, the state, the county, and each of those. So it will all depend, since the situation is different for each of the county, to the states. So you need to follow, the business needs to follow the guidelines from each of these agencies, particularly your county and the state. Know where, how, and what sources of exposure at work in non-work setting, and who is vulnerable and how to mitigate. So the most important thing I want to emphasize is educate, educate, and educate. So even though you might know, first you should know about what is happening in about this coronavirus. What are the hazards? What are the symptoms? How can you do? And you need to communicate it to the employees, so that what are they gonna do? How are they gonna do? Can we go to next slide? So there'll be a lot of disruptions in the workplace. So you need to plan for absenteeism. There's a need for social distancing, staggered work shifts. The main emphasis is to have no contact, because this virus is propagating a lot, and it's very highly communicable. So the main point is to have no contact, and the best way is to first have an online, go online. If you can go online with the work, that's perfect. If you can't, you need to take steps to make sure that you are having people not be in contact with each other. So social distancing, try to have the meetings online. Even if you're working in the workplace, have the meetings online. When no more than 2 people are more than 6 feet So nobody has to be near 6 feet. See which person is working in what part of the workplace. Okay, and downsizing operations, try to minimize the number of people, delivering services remotely, again, no contact, other methods to reduce exposure. Consider options for conducting essential operations with a reduced workforce. So if you can, try to reduce the workforce, including cross-training the workers. Also, cross-training the workers to carry out different jobs to continue operations. Next slide, please. So these are more guidelines from different agencies, and we have more, since this presentation will be shared with you, we have more guidelines at the end of this presentation. And I will also answer the questions which somebody of you asked about what protocols do we need at the workplace for the occupational safety and health. Definitely the first is to make sure that people are not getting in contact, make it online, educate people, because they need to know what is happening in the company. Have a hotline number if anyone is exposed or is supposed to be exposed, needs to go home. So these are my suggestions, and with that, I will give the presentation to Dr. Taylor. Thank you.
All right, so there's just a couple things I want to hit on briefly in relation to using technology as part of supporting remote work and different ways that you can use it more effectively or less effectively, and talk some about the risks associated with moving to technology. So Ryan, if we can go to the next slide. I want to talk about this briefly before we go to the risks, because I'm going to say some things in the next few slides that are going to sound really scary, but there's all different types of businesses out there, and there's all different types of risk. So when we talk about risk in general, but especially in the IT space, we like to look at how likely is this risk to happen, and if this happened, what's the magnitude of this going on? So for example, some of you may have heard about, there's been this rash of, it is technically a cybersecurity issue with open Zoom meetings, that people will jump on those open Zoom meetings that companies are using to run their operations, and they will post a bunch of pornography in the middle of the meeting, because that's actually fairly easy to do. And so we've got challenges to go, all right, well, are we willing to accept that risk and have open Zoom meetings? We want to put more security and invitations on who we invite. There's different ways that we can address that. But part of this is, when there's so much risk going on and so much change, you also need to think about the magnitude. How bad would this be if it happened? And then when we talk about managing those risks, there's really, we'll simplify it, 3 big things you can do about it. One, you can mitigate that risk by doing something different instead of what you were planning, or buying insurance or something to transfer the risk to someone else. Second, you could make a plan for it. You could have some type of contingency, a backup. Or third, you might just ignore some things and go, you know what, if that happened, that happens, and we'll move on. So what will have a large magnitude can depend a lot on whether you're a bank or whether you're a restaurant. And so as I go through these things, don't feel too stressed about it or too concerned. Make sure you take a step back and think about, all right, how likely is that? How bad would it be for me? And plan your actions judiciously to make sure that you're using your resources correctly, particularly in this stressful time. So if we can go to the next slide, Dr. Fuller. All right, so big picture. There's some things you should certainly be thinking about in terms of cybersecurity, data protection, and remote tools. So first off, from a cybersecurity standpoint, a lot of you have implemented remote work, remote teams. Now, if you are used to operating inside of an office where all of your computers have been connected to the same network, when you would share files back and forth, you would commonly be doing that across your local area network, which means that things weren't going across the internet. So if you think about sending something over the internet, think about sending a postcard. So if I send a postcard, it'll have an address who it's going to, it'll have where it's coming from, and it'll have content inside. But that content's really viewable by anyone who has access to the network. So the way we can get around this, and many of you have probably heard of these or are currently using, are called virtual private networks, or VPNs. So the difference between sending a postcard and a VPN is, think of it like certified mail. So how do you set stuff up so it's going to be encrypted, and the person who opens that packet of data I'm sending will be the person that's supposed to see it and nobody else in between. So VPNs are a fairly useful software. They're quite easy to implement. Many of you probably already have them. If you don't, and you're planning to try and get one in the near term, I would just caution you. A lot of VPNs are now used for consumers to try and get around things like digital rights management, to watch movies that are not released yet in the US, but you can watch them in China if your computer thinks you're in China, which is what a VPN can do. So be careful where you download a VPN. Go through reputable networks. Generally speaking, as we talk about in the IT business, if you're not paying for something, you are the product. So be very cautious about services that are, quote, free, because there could be malware, different types of viruses that are tied up inside of that. But certainly think about VPNs if you're going to be doing distributed work. You also need to think about your network capacity. A lot of your employees might be working on home internet connections that don't have as much speed as you have at the office. That can be problematic for things like running Zoom sessions or other types of meetings. So just be aware that there could be some variation. On data protection, you need to be aware that you're going to have employees that are connecting devices on networks at home that are possibly not secure, because home networks could have a lot of different viruses or other malware that you wouldn't have. I would expect at most of your offices you have some type of security services. You would have virus protection, you would have firewalls. Those may not exist on your employees working from home. And so you need to be aware and make sure you're talking to your employees about that and talking about the types of devices that they're connecting. You need to be careful with your storage and sharing of data. I'm sure most of you have heard of things like ransomware attacks. So thinking about how hackers can get access to your data, they can lock that up and then charge you money. Well, they'll try and charge you money to release the data, and they often don't release it anyway. So you need to think a lot more about how you back your data up and how you keep that data secure and with frequent backups, so that if you do have a malware attack or you do have a ransomware attack, you can ignore them and just go back to data from 2 or 3 days ago. And make sure you're thinking about your business continuity for critical items. Are there things that you can't live without, like email? Are there applications you can't live without? Make sure you have a backup plan if those things go down. Some other tools you should be thinking about in terms of remote work is, obviously, everyone participating today is familiar with video conferencing, services like Zoom or WebEx or many others that are out there. But I'd also encourage you to pay attention to tools like social collaboration for Yammer or Slack, or other social media tools that can be used within a company with control over your employee base so that you can have more privacy around those conversations. And make sure that you've got somebody available to provide help desk support. You're going to run into lots of employees who are going to struggle to log into their email, who might need passwords reset. You need to have some backup plan, somebody in your network of contacts who can help troubleshoot routine technical issues so you can keep your employees productive as they're working on new types of hardware and software. And we can obviously talk about a lot more of these on Q&A later, but that'll cue up some of the major topics. We can go to the next slide, Ryan. So just a few best practices in relation to remote workers, and there's a link to the Harvard Business Review article that I thought did a great job of laying this out. Remember, working remotely is not the same as working face-to-face. So make sure that you're taking time during the meetings to have some casual conversation. You probably walk up and down the aisles, talk to your employees, make sure everything's okay with their lives right now. One of the challenges when we get into these remote meetings is that often that we'll just get in, we'll get done, and we'll get out. I would venture to guess that almost all your employees are a lot more stressed about life now than they were when they went to the office. So they need that feedback from you more than ever. And so make sure you take time to do it. So make sure that you regularly communicate. Even if you don't have like a daily standing meeting, you might want to plan one for the next little bit so that everybody can feel a part of the team, even though we're working remotely. And then use video technology to create impromptu interactions. You can pop in just like we are now. If people are working online and they've got it in the background, you can ping them and make sure they feel that you care about them, that you're still aware of their needs. And on the other side, you got some don'ts. Remember that remote work is different. They're probably going to do it at different times. They'll have childcare issues they don't normally have to deal with. So be flexible. Look a lot more at what is the output that we're achieving rather than the hours that are put into it or the time at which those hours are spent. Be flexible. And for these in-person meetings, occasionally you might need something signed. We're going to try and minimize that in the near term, but make sure that things are predictable. And never forget to acknowledge remote workers for their remote work. You got to talk to them. You got to thank them. More important now than face-to-face. So use the technology, and it can be a great experience for you to start to better use technology in general once this crisis is finally passed. Let's turn it back over to Dr. Fuller.
Thank you, Joseph, and to my colleagues, Nitin and Rina as well. So I would like to talk about the resilience of family firms. As Stella mentioned earlier, I undertook a study with many of the member organizations earlier to examine their resilience. And you know, the chances are, as a family business, you're multi-generational. You have likely seen crises before, either at the organizational level or things like the financial crisis, and you've been able to weather those in the past. And so what I want to say is that something that sets family businesses apart from non-family businesses is some of these assets here, which include your common language of values and history, your ease of communication because of your family relationships, shared values that emanate from the family, a respect for organizational roles that also tend to blend with family roles. Here's something that's actually pretty critical and which sets organizations apart, family organizations, which is because of the desire to continue the business beyond the present generation and to transition it to future generations. You have the ability and willingness to sacrifice, to commit to long-range objectives. You also have a lot of social capital through your family relationships and through the networks that you've developed that can benefit the organization through this. So a lot of intangibles that your organization can tap into. I also want to talk about some guidelines for communicating with your stakeholders, both internal and external stakeholders, so your employees, but also your clients and customers. And these are general guidelines that apply for any type of crisis, but are especially pertinent and relevant when we're talking about issues related to public health. And so I'm going to try to go through this quickly, but I'm happy to answer any questions about this during the Q&A, but also offline. So, during uncertain times, right, we don't want to over reassure our stakeholders. rather we want to try to provide information that can protect them. We want to be open and honest about the situation. There's a lot of stress and anxiety, and I think also, some potential pent-up tension among people. And so something that I've seen that I'd also like to convey that relates to concern and empathy is to be kind, right? To emphasize being kind to others. This is a situation that is changing on a pretty much hourly basis with the number of cases and also the number of interventions that have been proposed. And so communicating that uncertainty, to your stakeholders is important, and also providing things that they can do to help themselves and others through a range of activities. And Professor Hammond and Professor Roy mentioned, some things that we can do to try to protect ourselves. And you can certainly share those with your employees and other stakeholders. So I want to try to end on a positive note, which is that we know that the current pandemic, which is also likely to trigger a recession, will threaten your organization's goals, but it also has the potential to create opportunities. And when I say that, what I mean is that this is a time when we can try to come together to try to develop some innovative solutions. These types of situations can expose cracks or gaps that allow us to address those for the next time. We can develop things like new strategies, new competitive advantages, as well as early warning systems for the future. Take these learnings and implement them into a plan. And so with that, final message, I would like to shift now to Q&A that you have for our presenters. And as Stella mentioned earlier, the Q&A will first prioritize health-related questions for our colleagues, Professor Hammond and Professor Roy. And then if you have other questions that you want to ask, use the chat function so that we're not talking over each other and on top of each other in our discussion.
Thank you. We do have one question. Do you propose any return to work screening? And so I'm going to guess that Rina and Nitin would answer those questions.
I think in terms of return to work screening, it's easier said than done. The most ideal screen we would have would be COVID testing to make sure that people are okay to come back, but that's not possible. So I think you just have to go by what CDC is recommending, which is what we're doing as well in the healthcare facilities, which is 7 days from onset of symptoms. So when the first symptoms showed up, a minimum of 7 days, and then 3 days of 0 symptoms at all. So no fever, no cough, no runny nose, nothing. And whichever of those comes later is when they would return to work.
Thank you. Does anybody else have any other questions?
I have a question. I'm a retail business, so the remote work environment doesn't really work for my type of organization. And we're limiting our hours now and providing social distancing, but we are also hit with the reality that we may actually have to either furlough or lay people off temporarily. And have a good portion of our workers are actually family members. Do we, in the event that we have to furlough or lay off people, is there any issues with nepotism that could become a legal problem? Does anybody know that?
So I'll jump in and start to answer that. And Dr. Fuller, I'm sure I have some more information later. The short answer is I don't think we really know, because the federal government, in all the proposals I've seen so far, do include a fair amount of support for small businesses. But the nature of what constraints you'll have to receive that aid, because they've talked about you can't lay anybody off, or you need to maintain payrolls at least a certain percentage of your previous payroll for a certain period of time, whether that will be loans or grants. I have not seen the final details on that yet. I think that's the type of thing that I know we're continuing to monitor closely, and as further details come out, I expect we'll be publishing that through that earlier link I mentioned that the College of Business is sponsoring. But a lot of that, I'm afraid, is still TBD. Anything to add, Ryan?
Just the commitment that we will, follow up and try to answer that question in a timely manner. And we're, like Joseph said, we are awaiting to see what the bill that is in the Senate right now looks like, and which of course has to go through the reconciliation process with the House. And so, what's in the Senate bill won't necessarily be in the final bill once they do that procedure. So TBD, as Joseph said.
I have a health-related question. This one is from a manufacturing firm. And if someone within the team tests positive for COVID, what processes should they take to assure that they're providing a safe workplace?
The best thing you can do is just have that patient be gone. I mean, sorry, if I'm used to talking patients, have that employee stay home, follow the same rules, the 7 days. The 7 days since onset of symptoms, 3 days symptom free. Everyone else needs to monitor for symptoms if they are exposed to this person. I would imagine they're not, since everyone's working from home for the most part. But if you are working at a shared facility, there's a list of cleaning agents and things like that that can be used, mostly bleach containing. So it'd be cleaning off, cleaning the surfaces and all of that this person has come in contact with. But the main thing is this person just needs to not be in contact with anyone else. If they can work from home, that's okay. But if it's not a work from home environment, then yeah, they just need to be away from everybody else for the recommended time period.
Professor Roy, do you have something to add to that as well? He's on mute.
Okay, I'm going to go to another question, which is for you, Professor Taylor, about Zoom versus GoToMeeting. Since you had mentioned that more open source areas like this can be hacked, which have higher security, even if they have to pay for a higher level of service or not?
All right, so for Zoom, GoToMeeting, they're both quite good. For educational purposes, I actually generally prefer Zoom because it's a bit more robust, but GoToMeeting certainly works. The challenge and hacking, the real question is on your security. So for example, let's talk about a Zoom meeting such as the one today. So we publish a link to the Zoom meeting. You can do a separate setting where only people who've been invited to the meeting can attend. And that would keep people from jumping in and stealing your data or sharing pornography, etc. However, you see how that's a lot more admin, because now when I set up the meeting, I have to set up the individual email addresses of everybody who I'm going to include in that meeting. And if I've got a large group, then that can be difficult. So really coming back to, like I was mentioning, the magnitude versus the likelihood, I can mitigate the risk of having people who shouldn't be on my meetings by using the security protocols that all of these software packages provide. But it takes time to do that. And so what it really comes down to is, all right, within your environment, how much do you care about security? How much do you care about controlling access? And then if you care about a lot, you got to make sure you're putting more administrative time in terms of how do I set up the meetings? How do I make sure that the chat functions work properly? How do I make sure that only certain people are invited? And if I miss somebody, how do I invite to get a chat to invite that next person? All these tools to support that. So the real cost is primarily your time to make it more secure. And so that's kind of where the trade-off is. I would say that I have seen a lot from Zoom on trying to do things to better support people versus in COVID-19. I have not seen much from GoToMeeting. They may be doing things, but they're not as broadly used. So either would work, but there are a lot of organizations that are giving extended or expanded support right now. Do you want me to go ahead and hit this follow-up Zoom question before we go to the next one?
Yes, please.
All right, so Zoom is a free service to a certain number of users. It used to be 50. I think they've changed that count, and they have dramatically expanded to support educational institutions, I know, in the last week. But generally, all these services, they're going to be free for a few people, but as you get larger, Skype's the same way, as you get larger, then you have to start paying for it. And so what I would look at if I'm the small business owner is, one, how many employees am I trying to interact with? If I'm dealing with small groups, GoToMeeting, Skype could be fine. If I'm dealing with larger groups, you're probably going to want to go to a more robust tool like Zoom or WebEx if you want to spend more with Cisco. And then think about, how long do I plan on using this and how much am I willing to invest? There are plenty of free options available now for small groups, but if you're going to do this for a longer term, you probably need to think about it a bit more before you implement.
So I want to add something there for the Zoom, is that the Zoom also gives an option for an added security level where you can put in a password and something for going to the meeting. So that you can use for security as a second layer of protection.
Thank you. It's time. It's 11 o'clock. And so I'd like to thank Professor Fuller, Professor Taylor, Professor Hammond, and Professor Roy for sharing with our members of the Sacramento region Capital Family Business Center. And if anybody wants to stay on for a few more minutes and speak directly, we're going to keep this line open for 15 more minutes. With that, if you have any more questions about the Capital Region Family Business Center, I have my website, our website information there. I will be sending a follow-up email to everyone that participated with this PowerPoint presentation, as well as all of the appendices and all of the other resources that have been provided. This webinar has been recorded, and we're going to put it up on our website shortly, as well as put it up on YouTube so that you can revisit any of the materials here or forward it on to anyone that you think will benefit. Thank you.